So we get lots of patients who do suffer with indigestion or reflux at various points in their lives. With reflux, it's where you're getting some acid from your stomach coming back up into the esophagus, which is the food pipe going from your mouth down to the stomach. And when that happens, it can cause a burning sensation, which is what we describe as reflux or indigestion or heartburn, some patients might call it. And that's one of the common symptoms that we get with just indigestion in general or reflux disease, but it can be one of the symptoms that we see quite a lot with patients with esophageal cancer.
The fundamental link between long-term heartburn and progression through the phases of esophageal cancer is that bile acid reflux into the esophagus causes damage to the lower esophageal lining. At a cellular level, it's inflammation, so it's causing inflammation in their esophagus, and eventually the esophagus responds by changing the lining from one type of cell to another. That other type of cell is a bit more resistant to the acid, but more prone to becoming cancer. And that's what Barrett's esophagus is. And then with persistent injury, with continued exposure to acid, that new lining can undergo genetic changes that predispose to becoming cancer and eventually become cancer.
If you're finding you're needing to take medication longer term, but we don't know the reason for it, it's really important that we find out what the reason is, why you're getting those symptoms.
Persistent heartburn is not normal. Get it checked. Just go and get it checked out.